What's up, guys? How's it going? Cade Moore with More Muscle. Today, we're going to be talking about vitamins. Guys, this is nutrition, and it's from my nursing class. So, guys, let's get into it. Guys, vitamins are organic substances required for enzymatic reactions. The main function of vitamins is to be a catalyst for metabolic functions and chemical reactions. Guys, so it's a catalyst, guys. Vitamins don't have any calories in them, but it's a catalyst for metabolic functions, and it's going to help your body. This helps in chemical reactions. There's 13 essential vitamins, and each having a specialized function. There's two classes of vitamins, guys. There's water-soluble vitamins, vitamin C, and B complex vitamins, and then there's the fat-soluble vitamins, A, D, E, and K, or you could just say vitamins K, A, D, E, CADE. Vitamins do not provide energy, but are needed to be metabolized, and it helps with a lot of functions in the body. So let's start with the first one, guys. Vitamin C, or absorbic acid. Guys, it helps with tissue building, healing, collagen formation, iron absorption. It helps with the immune system, helps it function correctly. It is found in citrus, fruits, oranges, lemons, tomatoes, peppers, green leafy vegetables, and strawberries. Guys, things that can lower vitamin C are stress and illness, as well as cigarette smoking. So for smokers, if you do smoke, you should be taking excess vitamin C. You want to be eating lots of oranges and stuff if you're a smoker. And same thing when you're sick, vitamin C is great because it can help with that. Severe deficiency can cause scurvy. Guys, scurvy, this is caused by a serious vitamin C deficiency. It's from not eating enough fruits and vegetables, and this can cause basically slow down the growth and the healing, and it can cause damage to your skin, and this can happen when you have chemotherapy, or you're not eating enough fruits and vegetables, or you're having like alcohol dependency. This can all have an effect on your diet, or if you have certain food allergies, this can also affect, or even type 1 diabetes or inflammatory bowel disease where you can't absorb that vitamin C. Severe deficiency would cause scurvy, like we just talked about, hemorrhagic disease with basically bleeding and painful joints, weakened swollen bones, and loose teeth. So guys, vitamin C is essential, and without it, with a severe deficiency, it can cause scurvy. Some signs and symptoms of scurvy are irritability, general weakness and fatigue, joint pain, rough scaly skin, being easily bruised or bleeding under the skin, losing teeth that may fall out, or even swollen legs or dry brittle hair. Treatments include plenty of vitamin C with fruits and vegetables or with a supplement. There's some now we're going to go to the B complex vitamins, guys. I think there's 12 of them, and some of them the body makes on its own, but there's some that we need to get from our diet. So each B vitamin has its varied duty. Some affect energy, metabolism, neurologic function. And leafy vegetables and unprocessed grains are great sources of B vitamins. So guys, like spinach, kale, other green vegetables, and unprocessed grains like maybe whole grains and stuff like that. So guys, thiamine. We're going to talk about vitamin B1, which is called thiamine. It's a coenzyme in energy metabolism. It promotes appetite and assists with muscle actions through its roles in the nerve functioning. Deficiency, guys, that's going to cause poor muscle movement, and it can cause clumsy movements. It can cause confusion, anorexia, tachycardia, which is a fast heart rate. It can cause weight loss, fatigue. And guys, basically food sources, basically animal tissues, basically meat, grains, and legumes, so beans. Vitamin B2, this works as a coenzyme to release energy from cells. Deficiency would result in chiliosis. Chiliosis is CHEILOSIS. don't know how to pronounce it, but chiliosis, inflammatory condition, and it affects the mouth, and it causes crackling, crusting, and scaling. It may make it difficult to yawn or to chew or to talk. There's also glossitis, which is like a swollen red tongue. And guys, if you want to get vitamin B2, it's in milk, meats, and leafy green vegetables. The next one is vitamin B3, niacin. Guys, this aids in metabolism, helps with digestion of fats, glucose, alcohol, and synthesis of steroid hormones, cholesterol, and fatty acids. Deficiency would cause pellagra, which is like a sun sensitivity, and it's also going to cause skin problems, GI issues, and it can cause anxiety, confusion, insomnia, and paranoia. Some sources would include meats, legumes, milk, whole grains, and enriched breads and cereals. Guys, the next one is vitamin B6, or pyridoxine. This helps with cellular function, synthesis of hemoglobin, and neurotransmitters, and niacin, right? So deficiency includes CNS disturbances, anemia, high intake of supplements, widespread food sources. Deficiency would cause CNS disturbances, anemia, or a high intake of a supplement. That could all cause those deficiencies. The food sources that have by B6 would be meat, grains, and legumes. And then, guys, the next one's pantothenic acid, which is involved in metabolism of carbs, fat, and protein. Deficiencies are extremely rare, but it results in a body system failure. The next one is biotin. It serves in the coenzyme used in fatty acid synthesis, amino acid metabolism, and the formation of glucose. Deficiency is rare, and this would look like neurologic problems such as depression and fatigue, hair loss, and a scaly red rash. Food sources include eggs, milk, green veggies, and I think this is the one that forms the nails. I'm pretty sure biotin. Folate, guys, this one's really important, especially for babies or a pregnant mom. Folate is in folate helps with hemoglobin and amino acid synthesis. Deficiency causes megaloblastic anemia. Guys, that's going to cause shortness of breath. Basically, the oxygen's not going to be able to go around your body correctly. It's going to cause CNS disturbances, and it can cause neural tube defects. So guys, basically folate, let me put it this way. Supplements, if a mom supplements with folate, it helps with 2/3. They're 66% less likely to not get a neural tube defect. So folate helps babies grow. Moms need folate. You need folate, so it's a good thing to supplement, especially if you're pregnant, or if you're planning to become pregnant. So folate's really important. If you go to the pediatrician, or if you go to the doctor and you're planning to get pregnant, they will probably tell you should take a folate substitute, or a folate. Eat a lot of food with folate. It's really important to have, and it helps form a baby. So guys, let's talk about some foods. Folate occurs in liver, green veggies, orange juice, and legumes. And folate's really important, guys. So next one is vitamin B12, or cobalamin. This is necessary for folate activation and red blood cell maturation. So deficiencies can be common with vegans or vegetarians. Because they're not getting enough vitamin B12, and the only form of B12 comes from animal products. So if you're not eating animal products, if you're a vegan, you need a supplement with vitamin B12, and that's going to help with folate activation and red blood cell maturation, and it's going to help your body get enough oxygen, because your cells are going to need the oxygen to move. Anyways, next, some sources include meat, shellfish, eggs, and dairy products. So it only comes with animal products. Okay, next we're going to be talking about fat-soluble vitamins, guys. And guys, fat-soluble vitamins can have a possibility of toxicity because it stays in the body for a long time. So be careful with supplements with vitamin A, D, or K. A, D, E, or K. And people that have cystic fibrosis, celiac disease, Crohn's disease, or intestinal bypass are at risk for these deficiencies. Clients who have liver disease should be careful not to take more than the recommended daily amount because it can be stored within the liver, and that can cause too much, can be excessive and can cause problems. So let's go to the first one, guys. Vitamin A. When you think about vitamin A, guys, think about vision. Without enough vitamin A, your vision is going to be, affected. So vitamin A helps with vision, health, tissue strength and growth, and deficiency would include vision changes, GI disturbances, and a hardening of the cornea. Foods with vitamin A include fatty fish, egg yolks, butter, cream, yellow, orange fruits such as carrots, yams, apricots, squash, and cantaloupe. Guys, that's why they always say eat your carrots, because they'll help you see better. Anyways, toxicity can come from taking vitamin A supplements. So you want to make sure you're not getting too much vitamin A supplements. And you want to my recommendation is just eat the foods that have vitamin A in them. That will help you regulate better. Vitamin D, absorption of calcium. Guys, so the next one is vitamin D. This helps with absorption of calcium and phosphorus, and it aids in bone mineralization. So guys, when you think of vitamin D, think of bones. Think of bones. Sunlight enables the body to synthesize vitamin D to the skin. Deficiency would cause bone problems such as rickets. Guys, rickets is when your legs are kind of curved and the bones just don't form properly, or osteomalacia, so that's bad bones. Too much vitamin D can also be harmful. So food sources include fatty fish, eggs, and fortified products such as cereal, milk, and orange juice. Guys, the next one, vitamin E. This antioxidant, it helps with preserving lungs and red blood cells. A deficiency is rare and can cause edema and skin lesions in infants. Food sources include vegetable oils and certain nuts. The next one, guys, vitamin K. This one's important, especially for babies. Right when a baby comes out, we usually recommend a vitamin K shot. And the reason is because it helps with blood clotting. So say if a baby that's not 100% developed, they come out of the womb and they have a slight bleeding. Their body may not be able to clot properly. So that's why we give a vitamin K shot, and that assists with clotting. Anyways, guys, vitamin K assists with blood clotting and bone maintenance. Deficiency results in increased clotting time. So, guys, if you cut yourself on accident and you bleed for excessive amount of times, an excessive amount of time, that could be a vitamin K deficiency. And guys, also warfarin. This is a blood thinner. A lot of people that have to take it if they have a heart issue or if they're not getting enough circulation in their blood. Guys, vitamin K is an antidote for warfarin. So if you accidentally take too much warfarin, then take some vitamin K or eat some carrots, some eggs, dark vegetables, spinach, broccoli, and asparagus. So guys, I had someone that had a heart attack in my clinic, not in my personal clinic, but the clinic I worked at, and they basically told me hey, I can only, when meals came out, he said, hey, I can only have this amount of vegetables or vitamin K or spinach, because he was taking warfarin, which is a blood thinner. So you want to make sure that with vitamin K, with warfarin, you have the same amount of vitamin K, so you can adjust the warfarin dose, and just so that warfarin doesn't get inactivated. And guys, vitamin K is found in carrots, eggs, dark green vegetables, spinach, broccoli, and asparagus. Guys, I think the best thing is to get a variety of foods and not to overeat. And that's going to help you and prevent any vitamin deficiency. Anyway, guys, hopefully you like this video. Subscribe. Hopefully you learned something.